First of all, I would like to give you the background, the motivation why I did this study, because maybe some of you remember I mentioned today in the morning that I'm really new to search engine studies. Usually I'm doing quantitative analysis like surveys concentrating on health information behavior. So this time this was really new for me. And I also would like to say that this is a preliminary analysis. It's not really like that this study will exactly publish like that. It's more like that I tried to get to know a little bit better how RED can be used and what can I also find out as a researcher considering this topic. I think that's important to know considering the next slides. So overall, why I selected this topic, I will quickly go through some results. So we can, or statistics. We can see here that the sexually transmitted diseases affect people in different ways in their everyday life, but also in their family planning, in their pregnancy, but also in their love lives. Unfortunately, it also can end with the death. So you see there is a lot of negative outcomes how a sexually transmitted disease can affect people's life. For example, you see 8 million adults between 15 and 49 years old were infected with syphilis, but you can also see here around 1 million pregnant women were estimated to be infected with syphilis. So you can also see this is not a topic that, for example, only affected men, it can also affect women. Yes. So as I said already, again, this is only a little bit more to show why I selected this topic or why I think it is important to do also a study considering those topics. Since I said that I'm doing research on health information, in my past it was more about self-tracking technologies like fitness trackers. So this topic was for me really new. And I found out that it is really important if you don't have the medical background, first of all, to understand a little bit more about those diseases, to better understand maybe also the search queries. And that's why I have this slide. So maybe some of you know that already. So there are curable and not curable sexually transmitted diseases. And they are differentiated between bacterial and parasitic, for example, chlamydia, gonorrhea, syphilis, and trichomoniasis. So, and as I said, not curable viral infections like hepatitis B, the herpes simplex virus, the HIV, and also human papillomavirus. So that are some of those sexually transmitted diseases. So that's already to the background. So what is the motivation now? So considering studies that are concentrating on information seeking, especially considering the internet, Google, most or several studies doing, for example, surveys. They ask the people, what are you looking for? And you know, or we know usually that surveys are more like our experience or what we think that we are doing and why we are doing it. Of course, there are also qualitative studies where you can do the interviews to get in-depth insight and to better understand maybe also the emotions behind this. And of course, you have also experiments. But usually, it's not like that. It might be a safe space. So in a survey, of course, the person is alone. Nobody can see usually who this person is and what this person is selecting. But for example, in a qualitative interview or also during a lab, the person is not alone. So my interest was also, could it be that if we are using such a software, that it might be considering privacy, which leads maybe to other search queries, because you know maybe other topics, if you're alone, you are Googling. Nobody is looking behind your back. You can do whatever you would like to do. And considering those really sensitive topics, it was a question that I had. It's not really that I said that is a hypothesis. It's more like that I asked myself about it and why I decided again to use RED. So as I said again, this leads me back also to that I asked myself, could it be that this topic, sexually transmitted diseases, might be also sensitive, might be connected to emotions? Could those queries be connected to emotions and to questions that those users have. Of course, the search volume, we talked today already about it. The gender, I mean, that was also why I showed you the background. It's nothing that's only for the male or for the man. It could also affect women. So I asked also myself, do search queries considering this, how they are seeking for information, or also maybe could we as a researcher identify maybe also if the gender is mentioned, in which direction the information seeking behavior was directed. Of course, related topics, we also heard that today a lot. If you have a search term, of course, you might be also interested in the related topics that are connected to that. And that is the motivation. So that was why I decided to use RED for this topic and to see what I can find out, or where maybe I can also continue later on with also theory and also a study design and all the other things that you need to do if you would like to do a study for publishing a paper, and of course the information need. So what did I do? I think that will not surprise you after this day, because we heard it a lot how we can use RED. Nevertheless, I will give you insights so that you can better understand what was the data and how the information that I will present you were selected. So first of all, we screened various websites in German to again create a list of sexually transmitted diseases, because I only show you 8 if you are considering back the World Health Organization, but there are much more. So we went, for example, to the Robert Koch Institute or also to Pro Familia to get a better overview about what kind of sexually transmitted diseases are existing. As I said, Professor Dirk Lewandowski said that today, or he also showed that in the model. We created, based on those selected keywords, an initial search query to see, is this selection really working? Could that work with RED? Then we decided also which search engines we would like to use, and here I need to disappoint you. I don't have the answer if Dr. Google is really helpful, because I concentrated on the 3 search engines, but hopefully I can do that in the future. So it was Google, Bing, and DuckDuckGo. Of course, I think that's obvious that the data collection is with RED. And it was, so the collection itself happened May 25 until June the 3rd. I mean, we also heard that when Dirk Lewandowski said it's nothing that can be done in 1-2 hours, so it needs a little bit of time. Some data points are, of course, average monthly searches, the positions, so the ranking in the search engine results page, and also the classifier result. And here you can see the initial keyword. So today I don't want to show you all the information considering to this keywords, and honestly, until now I didn't did data cleansing for all of them. I selected some of them to present today and to show you some insight, but that are the keywords we put into RED to get queries. And you can also see there are sometimes combinations. Yes. And for now, based on those keywords, the data set, so the original data set consists about around 180,000 documents. And what I did already, I did data preparation, data cleansing, so you can see I lost a little bit of that data because I found out that the keywords are not matching. For example, considering AIDS, there was a different or another language, so I decided to skip that. And also for the human papillomavirus, you see there is a totally different topic that has nothing to do with the sexually transmitted disease. And that is why you can see here that my data set right now changed. So. When I did that, and honestly I also need to say I started with herpes, and it was really challenging because, you know, herpes can also be oral herpes, And you can maybe imagine how big the keywords were and the results were. So I realized that if I will continue this, I really need clear rule-based process that another researcher can also do the same that I did. When I say, okay, that keyword is not part of the study, those unknown researchers need to understand why. And that's not really easy because I will show you that. For example, if you are looking for herpes, you see herpes simplex virus. That is a term. And the thing is that if you're going, for example, to the Robert Koch Institute, you found there an information like that the HSV1 is the oral herpes, but could lead to the herpes genitalis or otherwise. Which brings me to the question, okay, what should I do? How do I distinguish between keywords that have herpes or that have the ASV1 and 2? So this was really not so easy for me. Why I said again, I skipped that part for now, because yeah, I need a clear rule-based process for that. Yeah. However, I did some examples for today for the other keywords like AIDS, syphilis, gonorrhea, and I think there's another one because there the keywords were really clear, except the 2, 3, 4 that I showed you that I put them away of the set. So as I said again, these are results. They are preliminary and exploratory means. Of course, if you might have interest to join me and to do analysis with this data, maybe they are changes because of the coding, maybe again looking to the keywords. So here you can see the search queries based on red, and that are those where I said to you that I did already the coding or the cleansing of data. And you can see that gonorrhea has the most search queries. After that, AIDS, then syphilis, and really small are human papillomavirus and chlamydia. And I also need to say here that are the search queries, not divided on the 3 search engines. So I took them all and I looked only if the query is unique, and then it counted once. That's it. And here you can see, because this was the query, and these are the domains, the main domains. So here I also would like to highlight that I didn't look to the subdomains. So I took only Wikipedia, not Wikipedia/AIDS. That's the first thing here that you should have in mind while looking to this. You can also see the distribution here. And that's also again interesting because you see that there are many unique domains considering AIDS, but for example, a lower number for human papillomavirus again, and also chlamydia. Here you also need to consider we are talking about a unique main domain. That means I also again looked if the domain applies one time, that's it. So it's not twice or third or fourth. And I think, I don't know, can you read that? It's a little bit small, right? What I did here is now, importantly, top 10 doesn't mean the top 10 ranks in the search engine results page. It means the top 10 based on the frequency, how often the domains were in the data set. That's important here. And to highlight more the, for me, interesting findings or the differences, looking at Google, considering AIDS, we have the website HIV and more, which is not existing right now under the top 10 for DuckDuckGo and also for Bing. What you can see is that, for example, all 3 search engines have, for example, the URL www.internisteninetz.de, but on different places. That's interesting. So for me, the first time, I was a little bit skeptical if this is really a serial page because of Liebesleben, which means love life. But it is, and I wrote it down because I'm not good in that. It is from the Federal Center for Health Education, the BZGA. So it is promoted from them. And why it is interesting for me, because it's not covered from Bing and DuckDuckGo, considering the top 10 ranks again. So you see there are a few differences. Then we have NetDoctor. That is only occurring right now for the top 10 in Bing and DuckDuckGo. And that is, for example, a specialized health information page where you have a professional editorial team that is really also proving the content that is published there. So, Spiegel. So you see there are differences, and that's why I'm going like a little bit quickly through those results. Spiegel is only in Google, again, considering the top 10. And I also should say the numbers in the brackets, that is the accuracy of, in considering the top 10. When you read my abstract, then I also said I will have a look on if it is search engine optimized or not. Here you can see that the Internisten im Netz.de, which is, I would say, more in the top, so more in the first places, is probably not optimized, considering red. And, who had it thought, Wikipedia is also most probably not optimized, and it's still there. It has different ranks, but it is in all three search engines represented. And maybe also to add here, you can see on the first and second place you have AIDS-Hilfe and their RKI. So, for example, government services, authorities that usually have proved information and have a valid background if you would like to get information about, for example, diseases, illness, or also sexually transmitted diseases. So, as I said again, I played a little bit with the data, so I looked what can I do with the data, what can I find out. Apart from the domains, I was also interested in the query and the average monthly searches. And that was also the reason why I asked today Dirk Lewandowski, what is a good average monthly search volume, because I realized that there is a variety. And here we have exactly also the case, we have AIDS. So AIDS was one of the queries with 2,400. And after that you see it has a drop down with 100, and the next one is AIDS-Hilfen and AIDS-Schleife. And what I wanted to highlight is, and that is what was my motivation. I wanted to know what are search queries, what are people looking when they are and somehow are affected to this topic, if it is for the family, for themselves, for their friends. And I was a little bit surprised that, for example, questions, like you can see for the 30, that there is HIV, what is that? So it is really below. And so in my world, I thought maybe questions and emotions might be more in the top 1-2 places. But again, I don't have any hypothesis for that. That was my own thinking about the last years, considering those sensitive topics. You can also see very down that there is also the case with I. So like I am HIV positive, or also that people are afraid and Zwangsstörung, Angst for HIV. So you see there is some sensitive, emotional related queries, but not that much as I thought I might found. Here you see also for syphilis, and that was the thing why I said, what about the queries considering the gender? And if you have a look, you see, and I think that's also interesting considering users' behavior. Because if you write symptoms syphilis man, it's on the first place. But you see below, there's also syphilis man. So there's only one word missing. And I think that's also something interesting to understand, that also, as we know already, that how they are writing a query might affect also what they get and how the search volume is displayed. And you can also see based on those queries that, for example, even so syphilis for the male is more above, for the women it's more down. So if you see again the search volume, and that was for me really interesting to see those insights based on search queries. And the other thing is, and then I think I need to go a little bit quicker. What you can also see is, I don't want to call it more general, that because in the first place you have symptoms for syphilis men, and a little bit more down you have syphilis considering a place, like syphilis oral or also syphilis nose. And this was also much more later than considering the first two lines. So, and here we have gonorrhea. And that was interesting for me because here I split it, the table. So I will show you this table, and the next one is the continuing one. And here you can see that the symptoms of tripper for women is higher ranked, considering this, the average monthly searches compared to the male. And that's, again, as I said, for me it was interesting. So here you can see, and I will quickly skip that, I also had a look with red and the data that I had about the search engine optimization, and you can see that it is nearly optimized. Yeah, so you see the first one is for the first rank considering Google, the second one is for the second rank, and the third one is for the third rank. And as I said, I will quickly go them through because they are looking really similar, because most of those URLs were probably search engine optimized. So, and with that, I'm already done. That's my discussion point, and I would like to open it up to you because, as I mentioned, this was for me explorative. Thank you. So I would love to continue research with this data set because I think that could be helpful to better, maybe to try to better understand users and these topics. And I'm really open about your opinion, about your recommendations, also how to use this data. And of course also to join me, since I have a lot of data that still need to be cleansed. Thank you so much.